We come to tongue in a sagittal section of the skull. The tongue is supported by structures. From the mandible, it is supported by the very strong fan-shaped genioglossus muscle. It is supported by the hyoid bone, by the muscle hyoglossus. From the soft palate, by the palatoglossus muscle, and from the styloid process by the styloglossus muscle. It comprises of an apex and the base of the tongue. The oral surface of the tongue is pink in color, and at the junction of anterior 2/3 and posterior 1/3 of the tongue, there are these 8 to 10 circumvallate papillae, which have the maximum number of taste buds in them. There are muscles in the tongue, intrinsic and extrinsic muscles. The intrinsic muscles are the superior longitudinal muscle, the inferior longitudinal muscle, the transverse muscle, and the vertical muscle. The extrinsic muscles are the genioglossus, which is a life-saving muscle, the hyoglossus, the palatoglossus, and the styloglossus muscles. All the intrinsic muscles and the extrinsic muscles of the tongue, except palatoglossus, are supplied by the hypoglossal nerve, which is the 12th cranial nerve. This is the hypoglossal nerve, the 12th cranial nerve. It crosses the loop of the lingual artery, passes on the hyoglossus muscle to supply 7 out of 8 muscles of the tongue, out of which 3 are extrinsic and 4 are intrinsic muscles of the tongue. This particular nerve is the one which is carrying fibers of cervical 1, and it supplies the geniohyoid and the thyrohyoid muscles.